So today's topic is my thyroid cancer, surgery and recovery. I think um, it can be a little bit heavy topics, but uh, if some people can have uh, have more knowledge about their lives, then it can be very useful information or motivation, I think. mm, Actually, when I first realized that there is something wrong in my thyroid system was when I had medical checkup, and the lizard just warned me the uh, necessary of the more scrutiny, because there's a possibility of the cancer. So at the time, I reserved some university hospital for the scrutiny, but there's a lot of patients, so I had to um, wait for almost 1 month for my scrutiny. So I was fearful about it because I was not sure if I can make it, or if my some results can be dangerous. So I decided to change the hospital and visited another uh, the university hospital. Well, when I first um, at the time I just extract my blood from one of my arm for some check the components in my blood, and also the the day I uh, uh, go to see the doctor for the lizard, he just said, oh my gosh, but it's a kind of thyroid cancer, and the shape of that is formidable. That means it can be dangerous or critical to the some systems for some my organism systems for making voice appropriately. So when I first heard that, it was serious because I'm not too older, so never think about the possibility of cancer in my age. But um, actually, I just know that the thyroid cancer is a kind of most common disease in the women in our country, and hopefully there's no typical symptoms, and cannot be treated immediately and properly because of the high technology. But the word cancer is not welcoming things to me, and I just didn't know what I have to say to my family members or to my close friends. And the doctor said only only this one surgery can uh, cover or the bad components in my thyroid. So I was relieved about that, and uh, at the time I just curious why I have to have this kinds of disease. So I searched a huge amount of information on the internet, and probably many of things are inexact and not reliable. Um, and it was almost the first time about seriously thinking about my uh, health condition, because I usually work overtime, and I just believe that the only average level of challenging work or working hard. So I just thought that probably my stress is not too serious. But it was first time to take less time and avoiding working and just focusing on what I have to do, preparing for the surgery, and what is the careful things to make my body condition, health condition more um, more consensus with the better recovered conditions. So actually, before starting the surgery, I have to wait more than 2 months because lots of patients, but there's the lack of the beds in the hospital. So I just have to concentrate on the information what I have to do, and um, actually thyroid cancer means have to cut off one side of thyroid. So I need the additional pill for fi- the ability or that will replace the uh, another steroid. And only after finishing the surgery I can get some information about the inspection of my tissue of thyroid. And after that, the doctor said it was not too serious. So probably don't have to have any additional treatment or surgery. So, but after just the surgery, I realized that um, there are a lot of things I have to be cautious. For example, cannot exercise extremely, or have to care about the wounds near my neck. And but most most serious thing was the gaining weight because of the shortage of exercise. And I think usually more the habit I had a tendency to get uh, weight comparing with in the past prior to the surgery. Also, I think the surgery was simple because I could not feel anything during the surgery after the paralysis of all the body, but uh, the since I woke up from the surgery, the paralysis mm, gas, then my pain is worse. But the nurses also gave me the additional painkiller chemical medicines to my blood directly by using the injection and and after finishing surgery uh, I can I cannot I can immobilize, so needs a support of my mother, or even going to the toilet or visiting other places, and uh, had to drink a lot of cold water or cold juice, but it was not easy to swallow them. Actually, the surgical process was near my neck, and so thankfully thankfully I didn't have any hurt in my voice now, and some of a paralysis near my necklace for a long time. And um, actually, in my hospital, uh, all the people, all the nurses, doctors, and any other staffs were very thankful, and they are they are careful about the patients, and so they're really warm-hearted devotees can be the resource to recover promptly. And I was actually after diagnosis of the thyroid cancer, it was a little bit, on the one hand, it was a little bit relieved because that was not too serious in my case, and thanks to the high technologies, I can remove it properly, and the thanks to the devotee of the patient of the hospital staffs and all the people, the it's it also can be the chance to think about the preciousness of our life. And I realized that I forgot so many thankful things, and I just had considered that as very trivial and not serious things. And after the surgery, it's almost 3 months, and now I usually sometimes forgot that I had that thyroid cancer before, and um, at the time also I got some phone calls or text messages from close friends or from relatives or grandparents and family members too. So it was thankful and it was a little bit um how to say some a little bit and touched my mind. My mind was touched by other people's devotee and their bless. So I want to be this. My experience sharing can be useful or cheerful to listeners all. And thanks for listening to my short uh, experience experience sharing. And have a nice day. And also, I just in the last, I just mention about my thoughts when I first heard my third cancer. I just think I have spent a lot of time in working place and didn't have enough time to be with my family members or relatives, close friends, or precious people. So it was so regretful, and my my sensation always be focused on some what happens in my working place. So it was a little bit regretful because we work for our lives, but we are not exist for on the goals or on the for the uh, utilizations. We are not the materials only for the ways to make profits, but we we our exist is serve is very precious things and most precious things, and have to keep in mind that. So thanks for listening to my short experience sharings, and have a nice day. Thanks.